Hello, I'm Dr. Marcy Feynman. I'm the Associate Division Chief of Acute Care Surgery and the Program Director for the General Surgery Residency Program at Sinai Hospital of Baltimore. Sinai Hospital has a long history of training surgeons so that they are prepared to meet the demands and challenges of tomorrow.
So when I was looking at the residency programs, what attracted me to Sinai Hospital specifically was the size of the program. It's very small, only about 3 residents per year, which I really liked coming from a small town. I really like a small town atmosphere. I also saw that there wasn't really any fellowship programs, so I knew that I'd be getting a lot of hands-on experience in the operating room, so that was really attractive to me.
I've had very early operative experience. I was in the operating room on day 1. We are pushed to operate more than I think most programs, and so that it has been amazing for me as a resident.
Our distinguished faculty takes a flexible, innovative, and value-added approach to offer the most outstanding community-based, academically affiliated surgical residency program available. As a result, we develop technically excellent surgeons with solid clinical judgment, a broad range of skills, and a commitment to provide compassionate and effective care to all patients.
I chose Sinai as my residency program for various reasons, one of which was it's a community program and you have an early operative experience here. Additionally, there's the value-added year, which makes you a much more competitive resident in terms of applications to fellowship. And additionally, because of the faculty pool, the faculty here are very interested in teaching, and those were things that really drew me to the program.
The program has exceeded my expectations. Sinai Hospital is a community-based hospital, and I wasn't expecting a lot of involvement with academia or research, but here the faculty is very motivated for research purposes, as well as we rotate at 2 major institutions, Johns Hopkins and Shock Trauma, and the experience there has just really culminated in an excellent residency program.
My favorite part about being at Sinai is I think the collegiality among residents, the APPs, the program administration. I think we all play very well together. Everybody understands each other's roles and expectations, and I think everybody is here to help advance resident education and knowledge and make good surgeons.
During the course of 5 clinical years, residents receive training in all major surgical subspecialties and work in multidisciplinary teams on a large number and variety of operative cases in a wide range of settings. Our affiliations with the Johns Hopkins Hospital, the University of Maryland, and other high-level, high-volume institutions expose residents to cutting-edge clinical procedures and provide access to collaborative research opportunities and a wealth of faculty and facilities.
Yeah, so I think the faculty-to-resident relationship is really great. I have all of my attendings' phone numbers saved in my phone. I don't think there's a single attending that I haven't texted at least 2 or 3 times.
Faculty and resident relationship is excellent. I think the faculty goes above and beyond in ensuring that resident education is their top priority.
The attendings are very approachable, and it really allows me as a resident to maximize my education and my learning as best as possible. I'm able to ask the attendings for any feedback easily. I'm able to ask other residents for feedback, and everyone's just really approachable and friendly, and it makes working much, much better.
I find it so easy to talk about patients with them, to discuss them, to ask them questions. They treat us like peers, especially the farther along in the residency program you get. They start to talk to you about the management process. What do you think is going on? And they seem to appreciate what we have to say, which, I mean, I was very happy to find out. Yeah, it's very good here.
Also unique to our program is the value-added year, a program of postgraduate training that prepares our residents for an ever-changing healthcare landscape. Tracks include the business of medicine, public health, critical care and trauma, research, and the option to design your own course of study.
Our program is unique in that that year is dedicated and you're funded for that year. So I was able to go to Hopkins and work on quality and outcomes research in colorectal surgery. And I would not have been able to do that as easily as I had if I had to go find a grant. The program has been set up and this special year has been designed so that really you can do whatever you want to do to help expand and better your career.
Here at Sinai Hospital, we stress early and continued leadership responsibility with our residents to foster independent decision-making. Our program prioritizes continuous improvement, systematic evaluation of outcomes, and an awareness of the underpinnings of the healthcare system and the community it serves. Today, our graduates are pursuing successful careers in general or specialty surgery at academic and community institutions around the country.
I think the program has exceeded my expectations. First of all, it has helped me develop confidence in my abilities and skills. Doing general surgery, bread and butter cases with impressive amount of autonomy in a graduated setting. I think that has helped me tremendously.
We produce good general surgeons who want to treat patients. It was set up so that you could graduate this program and become a surgeon anywhere. You could go get a job as a general surgeon.
I think the value-added year at Sinai is a terrific opportunity for residents to distinguish themselves, especially matching into competitive fellowships. I went over to Brigham and Women's Hospital in Boston to pursue trauma systems research and health services research. And I think that helped me tremendously in moving my career forward in academic trauma and acute care surgery.
Well, here at Sinai, you don't just feel like you're a resident. You feel like you're part of a family, the Sinai family. And it's a good feeling.
Thank you for taking the time to learn more about the Sinai Hospital Surgical Residency Program. We wish you the best of luck as you embark on your surgical career.